Welcome to the Vision Quest video series, a step-by-step guide to holistic health. This program covers iridology.
My name is Amanda McQuaid Crawford, and I'm a medical herbalist, and I was trained in Great Britain, and I have a degree in nutrition as well, and so I see people for a number of different kinds of conditions, and I also teach a lot of classes and lecture widely.
In this film, we'll cover iridology. We'll understand the philosophy and the theory of this system. We'll have a practice session with an iridologist to understand how the eyes can show constitutional weaknesses. We'll also understand something about how color coding is used in iridology.
Iridology is the science of analysing the iris of the eye to diagnose constitutional strengths and weaknesses in each organ in the body. By studying markings on the irises of the eye and observing changes in them, iridology can locate problems in the body and the mind long before clinical symptoms begin to appear.
Well, iridology itself is a study of the eyes. Every marking, every colour, fine lines, even sort of shadings in the iris, the shape of the iris, the shape of the pupil, where the pupil itself is centred in the iris. Often it will be sort of slightly medial, which will indicate problems. The iris itself can be slightly oval on the lateral, or the upper or lower section will indicate problems. The white of the eye itself will indicate problems. Just the whole general marking, shaping and so forth. But the most important procedure is with the markings itself in the colour of the iris itself. And the rest of it will give you an extra indication of skin tone problems, etc.
Iridologists divide the iris into sections which are linked to the parts or functions relating to the body. The iris is also segregated into 6 rings or zones which correlate with the bodily systems. For instance, the first and innermost zone pertains to the stomach, the second to the intestines, the third to the blood and lymph systems, the fourth to the glands and organs, the fifth to the muscles and skeleton, and the 6th and outermost zone pertains to the skin. In iridology diagnosis, the left iris corresponds to the left side of the body and the right iris to the right side, although many organs or functions of the body may be reflected in both irises. In general, organs and functions in the upper part of the body will reflect their condition in the top part of the iris, while lower body organs and functions will relate to the lower part. In iridology examinations, white marks on the eyes are thought to develop through inflammation, too much stimulation, or stress. Dark marks on the iris are believed to indicate that a part of the body may not be working properly. A dark rim around the edge of the iris may indicate that poisons or toxins are accumulating in the skin because of an efficient elimination of waste products in the body.
There is a strong belief that you can't tell pregnancy from the iris itself. I certainly do agree with that, but because the iris will show abnormalities, and that's mainly what we're looking for. But often, and unfortunately it does happen, and you would be careful how you would approach that with the client, often you can see where maybe the woman could be prone to miscarriage and so forth, and I have detected that in a few circumstances, and sometimes even abnormality in the child, and have sent them off to have that checked and so forth. So I do believe very strongly you can tell if there is going to be an abnormality, but if it's a natural, normal type pregnancy, no, you would not detect it, and there's easy ways of detecting that, obviously, without having iridology anyway, but abnormalities I do feel strongly can be detected in the iris. Another one is there's a strong belief that you can't depict gallstones in the iris. I'm pretty sure in most cases I have always been able to pick if there's been gallstones, and have done many cases with gallstone problems, and I do feel I can detect virtually every case of that. I don't think I have missed any over the years, and I have been compiling a history for at least 26 years on all these types of details and so forth. So there are 2 things that have been mentioned over the years from other practitioners that can't be depicted, but I do do feel you can. There's many things the iris will show. It's just like anything. Iridology is something you learn as you go on. The more years you're doing it, the more you will learn from it, and a lot more to be learned yet.
Typically, iridologists recognize 10 different types of constitutions during iris diagnosis. Each type, which correlates with strengths and weaknesses in the body system, form basic patterns in the iris. A fine-grained pattern like woven silk indicates a strong constitution, while an open Hessian-like pattern in the iris indicates a weak one. In iridology diagnosis, many abnormal marks which are found may only be an early warning of problems. Many alternative therapists use iridology as one of their diagnostic methods and an adjunct to their particular therapy. An experienced iridologist will generally suggest a holistic treatment, such as better nutrition, vitamins, minerals, or be able to refer to practitioners, orthodox or otherwise, to eliminate any problems before they develop further. Although many ancient civilizations have used the eyes as clues to their patients' ailments, modern iridology first began with the work of the Hungarian doctor Ignaz von Pezsly during the 19th and 20th centuries. As a boy, von Pezsly had cared for an owl with a broken leg and noticed a distinct black line in the owl's iris, which gradually changed to white as the leg healed. In later life, Dr. von Pezsly became convinced that each illness will produce a telltale mark at specific points on the iris. In his research, he found that points on the iris would not alter, but in fact would be found in the same place on patients who suffered from the same illness. In 1881, he published his findings, and interest immediately spread across Europe and throughout the United States. In 1950, a doctor in the US, Dr. Bernard Jensen, continued Dr. von Pezsly's work and drew up a detailed chart of the iris, which is still used today in modern iridology.
Right. The styles that I'm aware of, there's Bernard Jensen, which is believed to be the, let's say, the top iridologist in America, and I would believe so. He's a gentleman that would have to be well in his 80s. I have been to quite a few of his seminars. He comes out here fairly regularly, every 3-4 years from memory. He's the whiz of iridology, in my opinion, and I have followed, my earlier studies were from his work. There is a German method as well that came out later. I think probably, I stand to be corrected, probably 15 years ago, 20 years at the most, it came to my knowledge. There was a German method as well. But the similarities, there's only a couple of discrepancies, and they're a very fine line between. I have done a lot of research into both, and there's very little difference in them. But I have always followed Bernard Jensen since that's where I first started, and then developed from there into quite a few other areas of my own as well that I don't know of many people that can do iridology to the extent that I can. I obviously stand to be corrected on that, but there would not be many that could do as much in the iridology as what I have been pursuing. Iridology will show many problems. Some of the examples of patients that present with problems would be asthma, skin problems like psoriasis, eczema, dermatitis, gout problems, gallstones, liver weakness, cholesterol, sugar level problems, menstruation problems, headaches, sinus, gout I think I might have mentioned, heart weakness, lung weakness, asthma, bladder weakness, many problems patients will present with. Just about virtually every problem patients will present with. And once you've done the reading, you can really ascertain where the weaknesses have come from. So once you can work out what organs are weak or what the problem is in the system, then you can set about and hopefully rectify that area, whether it be with vitamin therapy, manipulations, emotional therapy, operations. Many cases come in where I would send the patient straight off to the doctor where I've detected there is a terminal problem that in no way could have been helped through natural or alternative type therapy. I would not hesitate. I send them directly to the doctor. Often women with problems reproductive-wise, I would send them off to the gynecologist immediately. So the iris will show many different types of problems, and once you've got that reading down, then you can ascertain whether it's something that possibly you can help with, or send them to the correct therapist, whether it be alternative type therapy or whether it be medical as well. And that is the most important thing, to recognise what you can do helping that patient once you've got that history, or what you can't do with it. So the iris will show many, many problems, and just about anything that a patient presents with, a good iridologist should be able to ascertain where that problem's coming from and the depth of the problem. A good example is if you see somebody that's got narrowing in the fingers, here, that will indicate a heart weakness. But once you've done the diagnosis, you can tell to what depth the heart is giving trouble. Whites in the nails shows a zinc deficiency. Once you've done the iris, then you've got a better chance of ascertaining where that mineral imbalance comes from. Ridging in the nails means calcium weakness. So if there's ridging in the nails and it's an older person, rest assured that particular patient would be lacking in calcium, hence their bone structure would be weak. So obviously you would put them on calcium or a mineral combination according to age and what their temperament would be, and so forth. Once again, remedies will relate very much so to the temperament of the patient as well. So not only will the iris show the weaknesses in the organs, it will show where the origin is a physical or an emotional problem. And many times a patient might come in with a physical weakness and it's really not necessarily a physical cause. It can be, or an organic cause. It can be an emotional trauma that's happened previously, or something they're suffering with at the time. So once you can ascertain that, then you would work on that area accordingly. And often vitamin therapy or chiropractic therapy will help, let's say, get the patient back to a fairly normal functioning level emotional-wise, but in many cases obviously it won't, and then you would send them off to a practitioner that handles that particular area, or in conjunction with what you're doing, or whatever other therapy you feel would be required for that patient. The iris itself reflects the tissue tone in the body itself. So everything is reflected in the iris. So really the iris is a reflection of the internal. The same as people can diagnose from the feet, reflexology. You know, pressure work on the feet, the internal arch of the foot, left and right, detects weaknesses in the spinal column. So you can detect from reflexology if there's a weakness in the organ, but then when you get to the iris, that will show you the depth of the problem. So it's the depth of the tissues in the iris that will show you the depth of the problem in the organ itself. So it's really the tissue itself is in the iris is reflecting. It's like a mirror of the system itself. The colour coding in the iris itself, the iris will show 7 to 10 depths in the iris of tissue tone. Now the colour of the iris, what I have worked out to try and eliminate time with the reading, because otherwise you would spend hours with a patient, and time is a factor in a busy clinic, obviously. I've colour-coded the diagnosis itself, so eventually I might be able to put it into a computer and so forth, which would certainly make it much easier long term. So the colour coding itself, if there's orange on a reading, that normally means something that could be operable in the patient's life, and would be something that probably I would not handle, because it means that I would send them off to the doctor or so forth immediately to be operated on, and so forth. If there's arrows on a reading, it normally indicates that there is an hereditary terminal type problem running through the system. It doesn't necessarily mean that patient would follow suit and have a terminal problem, but it really gives me an indication that the particular parent they're following could be very subject to a terminal type problem. So the system itself will show whether there is hereditary terminal type problems, and whether the patient could possibly be susceptible to something similar, or whether they are going to acquire problems in that area. And obviously if you detect certain problems like that, then you would handle it accordingly with the patient, obviously with the practitioner that would handle that particular problem. So the iris itself will really show the depth of really serious operable problems, and in many cases terminal problems as well. Then when you come down to the marking of pink on a diagnosis, pink doesn't mean anything dangerous in the system, but it means it needs attention. So anything in pink, whether it be in the heart, whether it be something in the brain area, whether it be in the gallbladder, ovary, so forth, it means that organ needs attention, or long term that patient could have a problem with that area, and if left could end up having that then marked into orange, which would then mean something operable. So it's a warning sign, do something about that particular area, and it's normally the origin of any problem that the patient will present with. Now, red crosses on a reading, it's standard to have about 10 red crosses on a reading. If a patient had about 20 red crosses, it means that patient is very, very sick and not balancing well. So 10 red crosses wouldn't mean the patient has 10 problems. It just means the system is not balancing well, because you've got left, right, upper, lower lung. So that could be 4 red crosses if there was 4 areas weak in the lung. The bronchial shows on the iris in 4 places. So you could have 4 red crosses on the bronchial. So it doesn't mean they're straight off as eight red crosses. It doesn't mean that they've got 8 individual problems. The bronchioles and lungs do relate to each other, bronchioles being the filter area for the lungs. But if there's a red cross on an ovary, a red cross on a kidney, and a red cross on the thyroid, then that certainly indicates that patient has got a hormonal and an endocrine weakness, which once again relates to each other. And often it can be the thyroid imbalancing the kidney, or the kidney having an indirect bearing on the ovary. So it doesn't always mean 10 red crosses means that there's 10 individual problems. But it means that those areas need balancing, and you try and balance the system according to where the major links are. In that particular example would be the thyroid, adrenal, ovary. There is definitely a problem in the imbalance in the endocrine and hormonal system. So that's mainly what we're trying to ascertain. And then often you will see where there's a digestive problem, which would be in pink, and then straight away you would see a red cross on scurf rim. Now scurf rim means that's the outer part of the iris, and there's a dark circle around the outer colour of the iris, and that's what they call the scurf rim, which is your peripheral, your outer skin. And straight away that would indicate either skin weakness, or psoriasis, or pimples, or congestion in the skin, or fluid problems, and so forth. So what you're doing is trying to balance out where those red crosses are arising from, and normally in some way, in many cases they will relate back to the pink, or if there's orange on the system, obviously back to the orange. Now, once you get to a pencil cross, anything from under pencil cross is only to give me a grading of everything in the system. So pencil cross, yellow, green, blue, no colour, are not necessarily problems in any way in the system. But if a patient presents to me, whether it be now or let's say even 5, 10 years after they've had an iridology reading, and I never saw that patient after that original reading, they phoned me or came back and saw me and said, I've got this symptom or I've got that symptom, I would know from the iridology itself exactly where the weaknesses are in the system, but also what areas could never give trouble in their particular system. So if they gave me, a patient often will phone from the country that I haven't seen for years, and I wouldn't even remember who they are. Now, by pulling out their chart on the phone, if they were relating a particular problem, I would have a very strong indication as to where that problem is arising from. And most symptoms that patients present with will only relate to 1 or 3 organs. So once we've got what symptom they're complaining of, all we have to do then is just check the reading to see which ones show against that. So often if a patient complains of a skin problem, it might be a sugar imbalance causing it. It might not be anything to do with a toxic bloodstream or so forth. So once a patient can present me with a problem, I can detect very quickly from the reading where that origin is coming from. And once you find the origin, you treat, obviously, the cause of the problem, not the symptom. Diagnosis with Jan Shido, on the reading, as I did mention earlier, there was no, I could not see any susceptibility to any major operable problems and so forth. Pink on the reading indicated, which was on digestive system and transverse colon, the digestive system was very, very toxic. A fairly dark brown iris. There's a lot of green starting to come through in the iris itself over a period of time. So I do feel before my examination of Mrs. Shido, I do feel she's probably been on a fairly good diet for years and been looking after herself, because the system itself would have appeared to have been a much darker iris prior to me reading it. But there's still a lot of toxins and waste in the digestive system, and the transverse colon definitely showed a weakness in it, that there, as I mentioned earlier, I do feel she's got a dropped transverse colon and should have an X-ray taken to check that. So I'd like to have a look at that further, or get the doctors to check that, because I think the transverse colon has dropped considerably, but I do feel that I could help tone that for her. As she did mention after the reading, there had been an operation, as I had detected in the iris, on the colon, so part of the colon has been removed. So no matter what you did for that particular patient, she's obviously always going to have a digestive weakness, but I do feel we'd be able to help her considerably and probably get her back to about a 90%. A good functioning digestive system, let's say, without flatulence, constipation, wind, flatulence, wind, so forth, and bloating, which is what she's suffering. Her headaches, it showed in the neck on a red cross, which means the neck is not a major structural problem, but when it's a red cross, it means there's a lot of tension, or that there's a slight misalignment in that area. So she certainly doesn't need medication for headaches as such, in my opinion. I think, as I said earlier, that maybe 6, maybe 8, 10 good chiropractic therapies or osteopathic therapy on her neck would probably alleviate the migraines and so forth. There's definitely nothing in the brain area that would indicate tumours or that type of condition or anything that would create headaches. Even her symptoms don't present with something to that degree, but the iris would show me if there was going to be if there was any deep-seated problem, or let's say a tumour or something in the brain. So with the organs itself, the heart is definitely showing as a weakness in a red cross. Once again, red crosses don't mean that it's in a danger level in any way, but it really should be watched throughout her life. And as proven by the Iridology, as she confirmed afterwards, that her grandmother on her father's side and her father both died around the 50 mark with heart problems. I do not feel Jan will go around that age, but I do feel she could have problems later in life and should watch the heart closely over a period of time. Her left adrenal and kidney are weak, which is throwing her hormonal system. The left kidney has a bearing on her blood pressure, and over a period of time, if the kidney weakened, then that would weaken the blood pressure even more so, and in turn could then weaken the heart. So by strengthening the kidney, strengthening the heart would definitely, or hopefully, regulate her blood pressure, and once again, by strengthening the adrenal and kidney, would hopefully slow down the deterioration level in the heart itself. Her skin tone is just starting to age. She's at mid-40s, so that obviously would be an aging process starting, but by detoxifying the system, strengthening the capillary walls in the heart throughout the system. She did mention as well surface veins, which wasn't a big problem, was worrying her a lot, but in the iris it didn't show as being a major problem, but by strengthening the heart would even hopefully help strengthen the capillary walls for her and slow down once again the deterioration in that area. She mentioned that her eyesight as well was deteriorating after we'd finished the reading, and I did not see any major problems with the eyes. I think it's just a normal aging process, and often by having the neck manipulated or even just traction work and massage work on the neck will help slow down the deterioration in or the aging process of eyesight as such, but I didn't detect any major problem. She mentioned sinus problems. I feel most of that was contributing to straight out congestion in the digestive system and congesting the bronchioles. I didn't see any major lung weakness as such. Overall, her lungs themselves seemed to be quite strong. Her spleen appeared to be normal, so I didn't feel there was any imbalance in the blood levels in any way. Her pancreas was normal. I didn't feel there was any sugar imbalance, even though she has got a sweet tooth at times. I do think that relates to that hormonal imbalance. Her emotional level, as I mentioned, I think she's well balanced emotional-wise, but because the adrenal, that left adrenal is weak, often that will weaken the nerve system, and I think she is a worrier. She just appears to be a general worrier, even though to look at her today, she would not portray that. But from the reading, I just felt she lived on a nerve system far too much. And but it's not a deep-seated psychological problem. She didn't have psychological problems. Many cases that come in would be a psychological problem, and that would show in the brain as well if she was prone to suicide. She doesn't have those tendencies, but as I said, underlying, she's a worrier. It does show in the nerve rings, even though they're pencil. There was a strong feeling coming that she puts on a good front, but she lives on the nerves, and her energy levels could be better because of that. She's depleting emotional-wise, which is depleting her physical nerve energy. It's not so much a physical weakness, but the left adrenal would attribute to that. I don't think there's much else really to say on that. That would give us a good brief summary of what I found in the diagnosis. So the major points on that is a dropped transverse colon, a toxic digestive system antagonising bronchioles, weak left ovary with definitely a suggestion of maybe cysts forming again and should be checked. And I would, if it was me, I would be putting her on, if she's a patient of mine, I would put her on several therapies to help stop that formation. But obviously if it didn't, on the iris check in 3 months' time, I would then send her to a gynaecologist to have it checked further, since there was a history of it previously. As I mentioned before, long term, I think heart could be her problem, and obviously the blood pressure should be monitored, and heart every 5-10 years. If she was my patient, I would be monitoring it, and if I was worried in any way, I would not hesitate to get the doctors to check that as well. I feel the menopause problems we can correct by balancing the kidney and putting her on homeopathic remedies for that, and that would not take long for that area to rectify itself, so it makes it much easier to go through that change for her. Her skin tone, as I mentioned, will improve by detoxifying and strengthening capillary walls. I feel that sort of covers fairly briefly on her reading. With a reading, as it normally does take 2 hours, so I would be going into even a lot more depth, but I think that gives us the major points with Mrs. Shido. Well, the colour of the iris is, there's two basic colours, blue and brown iris people. Brown iris, obviously, the darker the colour, the more difficult to read, because if you've got a deep brown on a black, the difference is obviously minor. A blue iris, obviously, a light blue iris is much easier to read, because if you get a black or a dark brown or a brownish marking, it's easier to read. A blue iris person produces acid in their system, so they have a tendency to be drying of skin, arthritis, so forth. A brown iris person produces mucus, they have oilier skin, the body oils, better internal, external wise, so they have a tendency for more for rheumatism type problems, bronchial problems, that type of thing, whereas an acid system of blue iris will be a more drying. They end up with emphysema, things like that, because the capillaries dry out much quicker. Just as a briefing on some of the things, the differences. There's many different colours between blue and brown irises. If there's a combination in the iris of mucus and acid, then you've got a more complicated reading, a more complicated system, in other words. So usually I find that particular iris is more difficult to read, and usually you'll find that a patient has a more sort of very cross-section of problems in the system to what you would have with a true blue iris or a true brown iris. They're definitely a lot simpler to read, and the system is a lot less complicated, in my opinion, with that. Another thing is the texture of the iris itself. The depth of the iris will depict or determine the problems in the system, and the practitioner themselves reading the iris has to be able to make a judgment fairly quickly on each individual, for the depth of the colouring is very important, and that is one of the hardest things for an iridologist or someone learning iridology, to be able to ascertain the level. And when I'm teaching the boys, that is the most difficult thing for them, to be able to get a true picture in their mind of what the density of colours mean and so forth, and the markings. And many markings in the iris don't only mean particular weaknesses or strengths in that patient. often those markings are hereditary problems as well. A lot of iridologists read markings in the iris and think that it is a weakness in a particular patient. Not necessarily. It can be a weakness hereditary-wise, which means it doesn't mean that particular patient is going to suffer those problems. And that's what, with iridology, you want to be able to determine what the particular patient is suffering, what is acquired, what is hereditary. And once you can work that out, then you can get a true mapping of what that patient is obviously suffering. Okay, if you get a patient that's really fair-haired, blonde, let's say a 21-year-old good-looking blonde, hasn't dyed her hair, and really nice skin tone, good shape, that really nice, healthy, bright blue eyes, you see that particular girl around that mid-40s, you'll find in many cases she has aged much quicker than a dark-haired woman with dark brown eyes, because the skin oils. Oily, mucus-producing systems have a tendency not to age as fast as what an acid-producing system will be, because the acid really dries out the skin, and it seems to dry the internal as well. Obviously, anything internal-wise will affect the external. So if you see someone with dry skin or poor tone external-wise, whether it be a fluid problem, drying of skin, psoriasis, pimples, any of these problems will indicate something is wrong on the internal skin or fascia as well. So yes, a blue iris person has a tendency for their skin to dry, and they have a tendency to age much faster than a brown iris person because of the oily skin. Hereditary is something that I have developed over the years. Now, obviously I think that's something that's going to take quite a few years before we're going to see recognition in any way on that, because of, as I said, to my knowledge, there would be very few people doing hereditary type conditions in the iris. I have kept all my notes from the year I opened up as a practitioner with iridology, and over those years I have had many people coming back, especially people from 10 years plus, or back 10 years, relating certain problems, and whether it be emotional or physical, that I have mentioned to them, and problems in relation to their parents as well, or their children and so forth, that have definitely come true from what I have read on the iris, and there's many, many cases of that. So really it's only something that can be proven over a period of time, but you never stop proving it to yourself. I always tell the patients to come back and please tell me over a period of time if these things do come true. So really it is something that you can only time is going to prove whether that is true or false, but I really know within my heart it is really true. I have really proven it over and over again, even though 26 years is not that many years in practice to prove something like that, but it is long enough to really know whether it works or whether it does not work. And there's many patients that come back and relate that these things have arisen at, and virtually at the age that I have said. I feel definitely 95% accuracy, I really do, and I do not think I'm exaggerating on that. And once again, I really have proven that over a period of time. It's very difficult to put a percentage on that, obviously, but I do feel, I think iridology is an area that over the years will be found to become a very valuable diagnostic procedure in many fields, hopefully eventually. Who knows, it might be able to be used in conjunction with the doctors. And I do have quite a few medical practitioners sending me patients with problems with blood tests and so forth. So there's room for error in every area, including iridology. Iridology can only be as good as the reader, and it's only the time as experience with all of us. We never stop learning, and you learn from each patient. But as I said, I do have quite a few practitioners sending me patients from, let's say, orthodox medicine, as well as obviously alternative type medicine, for many different problems, deep-seated problems and even terminal type problems, and it will give us an indication of where that problem is arising from. There was a very good example of that a few years ago with a patient that had a spleen problem, and the patient presented feeling that he did have terminal problems, and the tests at the hospital could not detect any problem at all. A medical practitioner sent that patient to me. This will be at least 10, maybe 12 years ago. Sent that patient to me, and after doing the reading, I sent that patient back to the doctor, and I did feel that patient had a terminal problem in the spleen, and they did operate on that spleen from that diagnosis. And there's another case of a lady that I did a reading for, and one of the hospitals in Sydney did examine her afterwards, and I found there was a cyst on the spinal cord in the right C1 area of the spinal cord, and it was wrapping around it, and she had had tests, and no one had been able to detect it. That lady came to me. I did detect it. She went back to the hospital or back to her doctor, and she was operated on within 7 days, and I did feel she would have died if she hadn't gone to the medical practitioners immediately with that problem. And some of these things have been noted by the doctor. So there's many cases that we can help. It doesn't mean we can help with everything, but it certainly will give us an indication of some of these areas. So I said, with all of us, it is a learning ground for these types of problems. So iridology will really show many problems that can only be as good as the reader, and it is time and experience that will prove that. Well, I think mainly the most important thing, as you would be well aware of, that not to plant thoughts. If someone has a severe heart problem, you're not going to tell them that they have got a severe heart problem. Obviously, they could go home and will themselves into having a heart problem. They can talk themselves into it. And the fright of it, even if they're not talking themselves into it, the fright of it would be enough. So you've got to try and obviously buff it as much as you can. You don't want to frighten the patient, but be as honest as you can with the patient. Or if you get an 80-year-old that you feel in some way is probably only going to be here for a couple of years longer on this earth, you're certainly not going to say that in 2 years' time you're no longer going to be with us, because that poor lady would go home and start making out a will and decide she's going to go in 2 years' time. So you do have to obviously be careful depending on the particular emotional level of that patient. And once again, with all these things, that's just a discretion of the practitioner. But obviously one person can handle the truth more than another, but you certainly don't want to plant thoughts that will leave psychological problems there for the patient. So you do have to be careful what you do say to the patient, obviously. Future of iridology, I think, will take at least another 10, 20 years, who knows, to become sort of a household name. A good example of that is when I first started practice, patients would come in even for straightforward chiropractic type therapy, and we were treated as quacks, witch doctors, whatever, and people were really frightened of us. And it would take you at least 15 minutes to even get their confidence before you would even start taking details with the patient. They were really very wary, and some very frightened of it. Still, some people are very wary of it, but chiropractic, I've seen a big change in my 25 years of practice, or 26 years of practice, with people now. Chiropractic is becoming a household name, and I'm hoping in 10 to 20 years, once there's a few more really good iridologists in the field, that iridology will come in underneath as a very valuable diagnostic procedure for alternative type medicine, hopefully eventually to work in conjunction with the doctors. But obviously that would be a fair way off yet, I would imagine.
The eyes and the irises are like a roadmap to the body and mind, providing us with the direction which we must travel in order to find good health. It is a very unobtrusive way of discovering constitutional strengths and weaknesses in the body and mind, allowing problems to be diagnosed long before they manifest themselves as symptoms.